Good day, this is Sir Migs Morales, and we are now in the chapter 6 of nursing research, empirical phase. So before we start, our learning objectives for this chapter is first is to identify the different methods of data collection in conducting a research study. Second, distinguish the features, advantages, and disadvantages of different research instruments. And last, to know how to evaluate the validity and reliability of a research instrument. So empirical phase is more on how we collect data and prepare the data analysis. We have different types of data. We have the raw data and we have the tabular data. The raw data implies a records of admission or discharge, the birth or death, laboratory records, and treatment records. And you have the tabular data, it's the total number of patients admitted quarterly, total number of cesarean section per year. That's the existing data. It's more on secondary data or secondary source. For the original data, data that had been yet to be gathered or collected from the subjects using various tools or instruments for data gathering. Continuous versus discrete data. Continuous data may be found at any point along continuum or linear scale and cannot be measured accurately. Concept of bad or good. There is no bad point 1 or good point 2. So it is in the continuum level. But in discrete data expressed in whole numbers and can be measured accurately. Observational data, however, is data is obtained through visual observation of people's behavior, entails recording of events or findings, characteristics or condition of an individual, characteristic and condition of the environment, and communication of non-verbal and verbal communication. The observational data is preferably used by a phenomenologist or a qualitative researcher. Methods of observation, we have structured and unstructured. So in a structured observation, you have a checklist, you have a items or criteria to be checked uh, when you are doing your observation. Unstructured is it is based on the researcher's observation. It is more accidental observation. So he or she will note his or her observation within the exposure in the environment or within the interaction of with their respondents. Types of observers, we have the participants observer. The participant observer has two. We have overt observer and covert observer. The overt observer has full knowledge of the subject who will be observed, such as live experiences of cancer patients. So I know that all of these patients are uh, with cancer, and they knew that I am a researcher. Covert observer interacts with the subject and observes their behavior without their full knowledge. However, in covert observer, it's more immersion. You immerse in the setting, but the disadvantage of this is how he or she or the respondents will there's no full disclosure because the researcher only know that it's a research. So maybe it is an ethically unsound or could be um, not acceptable due to the principle of autonomy and full disclosure. First, phases of observer's role. First is the primarily observation and learning the ropes. You know? Researcher observe, listen, and have an acquaintances. So you build rapport if you do observation. You build rapport first with your respondents or with the community you are within the community that you are being exposed with. Phase 2 is primarily observation with some participation. Participate modestly in group activities. This observer's role is more on the ethnographic um, approach in qualitative research, because in doing uh, in doing observation and even participating on their practices, you emerge you immersed with their culture, their language, and their practice. Primarily participation with some observation. We have researcher learn by experience, participate actively in group activities. So if it's ethnographic research, you will attend their festivities, you will attend their rituals, their ceremonies for you to understand and explore more about their culture and their healthcare or their practices. So phase 4 is reflective observation. Reflects on the total process of what transpired and how people interact with and reacted to them. So if you're in ethnographic research and it's more an observation type of data gathering, the phase 4 is how you analyze, how you interpret their behavior, and what is the effect to the researcher, to you as a researcher. What is the effect and reaction to you as a researcher? So we have the non-participant observation. We have the overt non-participant observation. So for non-participant observer, we have the overt non-participant. So you will divulge that you are a researcher and you only observe their practices and it is only a research. So in the covert non-participant does not identify himself with the subject being observed. However, it's note, please take note that consider ethical implication that might possibly lead to a violation. So in covert non-participant, it is more on a bystander point of view. However, it um, it violates confidentiality and anonymity of your subjects. Strategies to prevent observational biases. First is the Hawthorne effect or the placebo effect. So what is the Hawthorne effect? If he or she is, they know that they are being observed, they will do the best practices. They will, because they are being observed, they will do what is right. So that's the bias of observation. We have enhanced of contrast effect. Observer distorts observation in the direction of dividing content into clear-cut entities. Converse effect and assimilatory bias. So we have halo effect, a figure in observation using rating scales, tendency of the observers to be influenced by other characteristics. So the halo effect is if you see the practices as good in your first interaction or observation, thus it affects the total results of your study. Error of leniency, tendency of the observer to rate every characteristics as positively. Error of severity, tendency of the observers to rate every characteristics negatively or too harshly. Biophysical, biopsychological data. It is biophysiologic measures, specialized technical instrument and techniques that assess the subject's physiologic status and physical variable of the study. Objective and are the most direct, precise, and sensitive means of quantifying biologic response, thus yielding high quality data. So the biophysiological data, it's more on your vital signs, your temperature, your BP, your fetal monitoring, and all of the data that can be gathered through instruments or equipments. Pilot study, sometimes called feasibility study, is a preliminary trial, a run, or a dry run of the major research. The purpose of pilot study is to make improvement in the research project and to assess problem that must be corrected before the actual study is attempted. So all of the research should have undergone a pilot study because for us to check if it's feasible, if your questionnaire is had collected the intended variable. So also if you do your pilot study, you can assess if your study is amenable to your respondents and to the community that will be affected. What's an instrument? An instrument is a tool which will be used by the researcher. Maybe may it be a questionnaire, a survey, an interview guide, and others. So criteria of an instrument, it should be reliable. Said reliable if it's consistent measure with accuracy, stability, dependability, involves the instrument and not the subjects. There's three aspects of reliability. We have stability, the extent to which the similar results are obtained and on two separate administration of the instrument. So stability, if you piloted tested the questionnaire to if your research is the effects of therapeutic touch to end stage renal disease patient and you tested it to therapeutic touch to end stage cancer or stage 3 or stage 4 cancer. So the results should almost the same. You should have almost the same results. So we can consider that tool as stable as and reliable as possible. So second is internal consistency, the extent to which the item of an instrument measure the same trait or attribute and nothing else. So if there's a item for in your questionnaire item for competency, so even you use it in different population, there will be consistency of that question will assess the competency of your respondents. Equivalence, the extent to which equivalent results are obtained by different observers. Errors of measurement. So we have method factors, we have instrument factors. There's some of the questionnaires maybe there's no directions or clarity. So there's clarity in wording and ordering of questions, format of questions, and poor item sampling. So clarity of directions. So for improvement, so we should have a simple direction if it's in circle or if it's check or tick. So please clarify your direction, clarity of wording and ordering of the question. So you can cluster or bracket your question per components and the format of questions. Though some of the literature they prefer all are positive questions, but we can use a double negative question for us to check the validity of the respondents' answers. Situation factors, there's poor lighting, extreme temperature, disturbance, or disturbing noise, location of data collection. So for this is applicable to quality and quantitative methodology of data gathering. So if there's poor lighting, they cannot read the questionnaire or the survey. Extreme temperature, disturbing noise, and location of data collection, it's applicable to qualitative research. It's more an interview. If the respondent is not relaxed, it's not at ease, so it will affect the results and it will affect the the response of your informants. Trait factors, errors of measurement, we have respondents' personal factors, we have general characteristics, test taking skills, ability to understand instruction. So the your population and sampling is very important to for us to tailor fit your questionnaire to your specific informants or respondents, because if you have chosen a group of indigenous people, so thus you should adapt and should have change or maybe place a Tagalog version of your questionnaire, or even to translate it on their specific dialect for them to understand more about the questions. Temporary characteristics, the emotion, the fatigue, the bias, the motivation, the hunger, the illness, or the mood. So, you're doing your research after a typhoon. So, it will be tainted. Your results will be not conclusive because their answer may be affected by the current state. So be mindful of doing your research plan and data collection, and do your necessary adjustment if needed. Response set bias, enduring characteristics of the respondents, social desirability, and acquaintances. So this is also applicable in the qualitative research. You're doing your interviews. So again, let's go back to the basic. Do your nurse-patient interaction, the therapeutic communication, build rapport, listen, active, do your active listening, and don't go straight ahead on asking the question based on their interview guide. If you're doing phenomenology, you can ask first their status today, how do they feel today, and build rapport. We have general characteristics, respondents' personal factors, there's level of ability of observational skills, and bias in grading, temporary characteristics, also the emotion, non-adherence to data collection, improvising question, alteration in coding categories, altering time duration of testing. So there will be an error of measurement if you will not stick to your research plan, because it will affect also the compliance of your respondents. Just say if you plan to do your interview on this specific date, stick to that specific date or inform them beforehand. Consideration to increase reliability of research instrument. First, increase the number of items observation. So if you increase the number of items, so you will have a more comprehensive um, analysis of the specific components of your study. Eliminate the items that are unclear. So based on your pilot study, you've seen that all of the respondents or the piloted informants had been confused on this item. So you can revise it or you can remove it. Standardize the condition under which the test is taken. So now, due to pandemic, so all of our survey or questionnaire is being collected through um, website or online platform. Moderate the easiness and difficulty of the test. Minimize the effect of external events. Postpone the assessment if the major external event occur near the time of testing measurement. Standardize the instruction and make sure the subject take the test under exactly same condition. Keep scoring procedure consistent. Strive for consistency in grade. So we have done on the reliability. Now is the validity. Validity is the degree of the instrument. Measure what is supposed to measure. Validity when it measures what it claims as supported by evidence. So we have different types of validity. We have the face validity. The instrument looks as though it measures the appropriate attributes. Measure how well the items they measure the appropriate criterion. And content validity is the instrument has the appropriate sample of items for attribute being measured. Measures how well the items represent the entire universe of items. Construct validity, if it's truly measure the abstract concept or construct that it tends to measure. The more abstract the concept, the more difficult it to establish, such as fear, pain, death, dying. Measures how well a test assess some underlying constructs, examine whether test performances reflects an underlying related variable of constructs. Criterion related validity, if scores correlate highly with scores of the criterion, and if it's useful predictor of other behaviors, experiences, or condition. Current skills, aptitude test, concurrent validity is if it can distinguish individuals who differ on a present criterion. Predictive validity, if it can differentiate with adequacy of people performance on some future criterion. Criteria of evaluating research instrument: comprehensibility, efficiency, objectivity, reactivity, sensitivity, specificity, simplicity, and speededness. So, guidelines in developing an instrument. First, it suits its function or purpose as relates to particular purpose of the study. So, if you will select an instrument, go back to your objectives and uh, research problem. Based on the study theoretical framework, is it valid and reliable? Gather adequate and accurate data to test the study hypothesis and answer questions under investigation. The questions or the instrument should be simple with simple direction, free of bias, and built in clues. Design and constructions minimize cheating or contamination through outside influence. Methods of collecting data, we have questionnaire. Questionnaire must have a cover letter accompanying the questionnaire. What's advantage is it's economic of time and money, ease of testing its reliability and validity, ability to maintain respondents' anonymity and confidentiality. The disadvantages of which is costly printing and mailing, and low response rate. Other disadvantages of questionnaire, we have difficulty of retrieval, requires respondents' literacy and understanding, and cannot be used for extremes of age. Steps in preparing a questionnaire. First is to decide what information to be sought. So let's go back to your objectives or the research problem. Will the demographic profile will be included in your questionnaire, or only the pertinent data such as competencies, and is it adapted questionnaire from a theory? Decide what type of questionnaire should be used. Write a first draft of questionnaire, free response, or multiple choice. Re-examine and revise a question. Do your pre-test. Edit a questionnaire and specify the procedure. Guidelines in wording a questionnaire. First is use words that are clear and specific. Don't use ambiguous words, and limit jargons of our healthcare. Next is use simple, direct, and familiar vocabulary. Keep questions as short as possible. Avoid double-barreled question. Avoid leading question which leads the respondent to a particular answer, such as, most people favor RH bill. What do you think? Avoid loaded words or emotional-laden words. Use psychological affected rather than psychiatric illness or mental illness, and special needs rather than abnormal, retarded, or mongoloid. Guidelines on the ordering of questions. We have start with the most interesting question in order to capture the respondent's attention and interest. Establish rapport before asking questions pertaining to sensitive matters. For self-administered questionnaire, obtain demographic data at the end. For interviews, obtain demographic data at the beginning. Use funnel question. Start with the more general question, progressing to a specific question in a given topic. Use filter question appropriately, carefully, and cautiously. Example, have you ever been received treatment for UTI? If yes, answer the question 1 to 5. If no, proceed to question 6 to 10. Regarding the interview, the most common type of instrument next to questionnaire is the interview. So we have the interview schedule. Questionnaire is read to the interviewee. Interview guide, loosely structured interview. Schedule that provides idea about the topic content of the interview, but allows freedom to the interviewer to pursue relevant topics in depth. Elements of an interview. First is to establish rapport. Second is listen analytically. And third is probing. Probing is expectant silence, conveys message that's more expected. Request for clarification. Request for elaboration. Fourth is motivating, and 5 is maintaining control. Questions are asked in a prescribed manner. So we have types of interview. We have unstructured and semi-structured interview. With unstructured, there's no interview guide. Semi-structured, we have interview guide, but we can add questions. And for the structured interview, the interviewer are using a standardized question. So these are the rules of conducting an interview. First is to be precise with choice of words. Second is keep your question short. Third is use the language that's understandable. Avoid jargons or technical terms. Use open-ended question. Close-ended questions should be avoided. Observe proper ordering or logical sequencing of question. Avoid leading questions or improper emphasis on words or phrases, so as not to indicate the answer desired by the interviewer. Avoid loaded or double-barreled questions. We have different forms of interview. We have personal interview, it's more on face-to-face, and telephone interview. The advantages of which is the respondents can seek clarification, interviewer can observe the nonverbal communication during the interview. Checklist. The instrument used if a target behavior cannot be adequately or accurately captured with the use of interview or questionnaire. Example of categories. Okay. We have always, frequently, occasionally, seldom, never. So this is the 10 commandments of data collection. First is think about the type of data that will have to be collected to answer the research question as early as you start planning to engage in the research process. Think about where you will get the data. Make sure that the data collection form you are using is clear and easy to use. Make a duplicate of data file and keep it in a separate location once you transfer scores to your data form or sheets. Do not rely on other people to collect or transfer your data unless you have personally trained them and are confident that they understand that data collection process as well as you do. Plan a detailed schedule of when and where you will be collecting your data. Be prepared for anything and allocate 25 to 50% more time in your schedule for unseen happening. Cultivate possible sources for your participant pool as soon as possible. Try to follow up on subjects who missed their testing session or interview. Call them back and try to reschedule. Never discard regional data. Other researchers may want to use the same database. Follow the previous and return to the original materials for further information. Triangulation. Triangulation is an attempt to map out or explain more fully the richness and complexity of human behavior by studying it from more than one standpoint. So preparing the data for analysis, we have coding, process of translating verbal data into numeric form, organization analysis of data, we have statement of purpose, research question, and research problem. So now, let's go back to our learning objectives. Did we identify the different methods of data collection in conducting a research study? Now we are aware of the features, advantages, and disadvantages of different research instruments. And you are now equipped to evaluate the validity and reliability of research instruments.